Hello, my name is Dr. Dawn Adamson. I'm an interventional cardiologist in the Midlands. I'm the National Specialty Advisor for Heart Disease for NHS England, and I sit on the JRCALC committee. I'm also the lead for the Heart Attack Expert Advisory Group, and I've led on the latest review and update of the Acute Coronary Syndrome guideline, which sits in the medical section of JRCALC Clinical Guidance and on the JRCALC Plus app. Following a survey of the primary PCI centres from paramedic and ambulance trusts, we understood that there was communication issues as to who to refer and who not to refer. So we've now included standardised criteria for referral to primary PCI centres based on the symptoms, the time of onset of the chest pain and ECG findings. So the standardised criteria includes the thresholds for ST elevation, when your primary PCI centre should be contacted, but we've also included the recognition of atypical presentations and made some clear guidance on bundle branch block, both left and right, as well as posterior MI patterns. Obviously, we do still advise discussion with the primary PCI centre for patients that are very unwell, with chest pain and widespread ECG changes, such as gross ST depression, even if they don't meet the core criteria, as immediate angioplasty may still be appropriate. We've also made some changes on medication. So we are recommending that if you're giving an opiate for pain relief, that an antiemetic is given at the same time, even if the patient isn't initially feeling nauseous or sick, mainly because we often see these patients do develop that later on, and then there's a risk of aspiration, or maybe more importantly, the loss of the antiplatelets, which can then obviously affect stent thrombosis. Also, we appreciate that GTN has been widely recommended in the past. Whilst GTN is excellent for non-STEMIs or angina because it causes vasodilatation, in the case of a STEMI, the artery is completely blocked. So that vasodilatory effect is not really being used. And instead, it might be causing low blood pressure or affecting the patient's hemodynamic status. And therefore, we've taken the routine use of GTN out of the STEMI guidelines. So these revisions have followed work by NHS England's Cardiac Transformation Programme and the Heart Attack Expert Advisory Group that have been working together. And the updates are there to provide a consistent national criteria which supports early recognition and appropriate referral for primary PCI, really to try and improve decision making and ensure that patients receive that timely access to specialist care. We are aware that there's been delays in the whole pathway from symptom recognition to angioplasty, and we're trying to sort of look at each section of the pathway and shorten it. So what we are hoping is that by making these guidelines clear, that we're going to reduce the time on scene, which will improve the core to balloon time. In other words, improve the time from the patients recognising their symptoms to actually having that artery opened. We're hoping that the essential treatment is prioritised, and that by having that improved and clear communication with the primary PCI centres, that paramedics that are dealing with these sick patients have got a clear line of sight as to where to go and who to talk to try and improve the overall experience both for patients and for the paramedics.